Limited that offers online diabetes education to students globally. So Dr. Mucheru will talk to us this evening for about 50 minutes or so, and then we will have the question and answer session. And I would like to welcome you all. PCA Kaskari medical scheme is open to all members of the PCA Church. It is affordable and enables our members to meet the demands of Medicare when that need arises without the normal hassles of probably being asked to pay a huge deposit, and even to soften the journey of recovery from a financial perspective. So we encourage as many people to join as possible. So thank you very much. With those few words, I want to invite Dr. Mucheru to take us through. Karibu Daktari.
Okay, good evening, everyone, and praise God. Thank you, Roy, and the team, because of this invite to be talking to you today about chronic disease management. I'm privileged and indeed very honored to be among you all tonight, and I'm hoping that we'll just exchange just some knowledge within the next 40 minutes, and then have a short Q&A so that we can call it an evening by the time it's hitting 9:10. Okay, so this evening we shall be talking about chronic disease management. And there are many chronic diseases, but today I've chosen to talk about metabolic diseases, that is diabetes, high blood pressure, and abnormal cholesterol. And then we'll just do a small wrap up as we look at the prevention and management strategies, and then that will lead us to the question and answer session. Now, when we talk about chronic diseases, we are talking about diseases that are there for the long haul. These are persistent diseases in that they last for a while. They don't, they are not acute, as opposed to the acute diseases that last for a short time. This one, they take many years, they are long lasting, they are persistent, and they last for a long time. So that's what chronic diseases is defined as. This is as opposed to the acute diseases that last for a short time. So things like respiratory infections, skin infections, surgical conditions that once sorted out can go away. Those are acute. But here we are talking about chronic diseases. Now, when we talk about chronic diseases, there are various categories of chronic diseases. We have what we call the metabolic chronic diseases. And when I talk about metabolic, I mean the way the body handles food. So we're talking about the diseases like diabetes, high blood pressure, abnormal cholesterol, which is going to be the subject of our talk tonight. But there are many other chronic diseases. We have diseases that affect the bones, the bony structure or the bony system of our bodies. So things like arthritis, which affects the joints. Things like osteoporosis. Osteoporosis means weakening of the bones, and this is a common condition among especially women, postmenopausal women above a certain age. We have things like fractures that can also occur as a result of the bones being weak. Again, these are chronic diseases that can affect the bones. We have cancer. Cancer, of course, we are aware that the prevalence or the number of new cases that are being discovered every day is on the rise in our country. Whether that is because there is an actual increase in the number of new cases, or that they are better diagnostic, I think that's a debate for another day. But I think we all know that cancer has been there. We all know people who are affected or affected by cancer. So it's one of the chronic diseases that we are seeing a lot in our community. We also have other diseases like asthma, other lung diseases. We have heart diseases, things like heart failure, heart attacks, and so forth. Again, these can be chronic diseases. We have other chronic diseases that affect the immunity, where your own immunity turns against yourself. So we have things like lupus, lupus disease, and many other autoimmune diseases that can affect and can become chronic. We also have other diseases that affect other systems, such as the sexual dysfunction in male and female. And I think as we discuss about diabetes, we are going to touch on that a bit. So as we can see from this, there are many chronic diseases. Uh, we have diseases that these are diseases that are long lasting, persistent. We shall focus on diabetes, high blood pressure, and cholesterol for this evening. But at the end, we shall do a wrap up and then see whether we have some questions and answers. Have a question and answer session at the end. Now let's start with the issue of diabetes. Now we all aware about what diabetes is. So this is basically chronic elevation of blood sugar. And when I say chronic, I mean in terms of the timeline. So this is has been there for a long time. So chronic elevation of blood sugar. Now we have several types of diabetes. We have what we call the type 1 and the type 2 and gestational. Now type 1 is the kind of diabetes where your insulin, or the chemical that helps transfer sugar from the blood into the cells, is lacking. It is not there. It's absent for one reason or another. So that is what we call type 1 diabetes. Now, type 1, we mostly see it in younger people. It can affect persons of any age, but we mostly see it in younger people. And so when a teenager or a child comes and their sugar is elevated, that is most likely type 1. But we also do see type 1 even in older people. One of the prominent people who was diagnosed with type 1 diabetes at an older age was the former Prime Minister of Britain, Theresa May. So she has type 1 diabetes, and that was discovered in her 50s, I think in her early 60s. We also have type 2. Now, type 2 is by far the most common type of diabetes. Over 80 to 90% of people presenting with diabetes, it will be type 2. So this is diabetes that has its onset mostly in older people. And when I say older, let me not use the word older. Let me use middle-aged to older patients. So that is people in their 40s, 50s, 60s, like that. They are likely to have type 2 diabetes when they come to us with high sugar. Now, the interesting thing now is that we are beginning to see younger patients presenting with type 2 diabetes. So these are patients in their 20s and patients in their 30s. And as we discuss about the risk factors, we'll discover why there is that shift from people in their 40s and 50s to even people in their 20s and 30s. We have seen patients who are 25, 29 presenting with type 2 diabetes, which traditionally has been a diagnosis that has been there in older patients. We have diabetes that can affect pregnant women. So patients who are pregnant come and present with high sugars, and that is not good for the baby. It is not good for the mom or the pregnant lady, because that can also can cause many other complications. That's again another type of diabetes. And then we have other types of diabetes which I don't need to mention here. So the point there is type 2 is the major type of diabetes, and that's what I want us to focus on today. Now, when do we know that we have diabetes, or when do we suspect that we have diabetes? We suspect that if our random blood sugar, that is a test that we do with the glucometers, is above 8 after feeding, or above 6 upon fasting, or this is before meals, like before breakfast. If it's above 6, you're getting a 6, 7 before breakfast, then you might want to have a formal check for that. If it's above 8, 8, 9 and above after meals, then you might also want to get a formal check for that. Now, what are some of the risk factors, or what are some of the things that predispose one to getting diabetes? Number one, and this is very important because as we go through this list, it's important to place ourselves here. And when you have any of these risk factors, then it is very important for us to go and get checked. So, number one is a family history. If you have a family history of diabetes in your immediate family, that's your nuclear family, and I'm talking about your parents, your siblings, your your children, then it means that genetically you are at risk of getting the same. So a family history. Secondly, overweight and obese. So when your BMI is above a certain point, body mass index. How do we calculate body mass index? We take your weight in kilograms. So, like me, I'm around 72 kgs, and then we divide that by the height in meters squared. So, I'm 1.72 meters. So 72 divide by 1.72 meters squared, and that one gives you a figure there. And if that figure is above 20, if it's between 25 and 30, then we say you're overweight. If it's above 30, we say you're obese. So overweight and obese are big risk factors for developing type 2 diabetes. Now, part of the reason why we are seeing a lot of type 2 diabetes, even in younger patients, is because of this overweight and obese. So we have a lot of patients now who are obese, they're overweight, they have sedentary lifestyles. So that means they are not very physically active. And you can see there's a lot of motorization in our transport and many other things. So we are hardly walking. And when we hardly walk, we don't activate our muscles. And this is actually one of the major risk factors for type 2 diabetes. Now, if you ever have had a history of diabetes in pregnancy, that's also a very big risk factor for developing diabetes in the future. So it's important for us to tell, for maybe our daughters, because I know many of us in this call, maybe we're above a certain age, but so maybe our daughters, if they've ever had gestational diabetes, then it's important to tell them to always get checked because this is a risk factor for getting future diabetes. So if you have other conditions like high blood pressure and high cholesterol, that can also predispose one to getting to getting type 2 diabetes, plus other conditions like things like polycystic ovarian syndrome, things like chronic use of steroids, and so forth and so on. So the reason I'm talking about these risk factors is so that we can place ourselves, and if you have any of this risk factor, then it is important that every year you go and get checked. Yeah, maybe even twice a year to go get checked to see whether diabetes may be cropping up. Now, what are some of the symptoms of diabetes? Now, when diabetes is early, it is asymptomatic. And by asymptomatic, I mean it does not give you any symptoms. In fact, many times diabetes will not give you any symptoms when it's just starting. Okay, so you'll just be okay. You will not have any problem. But when you go and get checked, then the sugar is going to be high. Yeah, so that's why it's important to look at the risk factors, because if you wait for the symptoms, then it might be too late. Now, you can also get very subtle symptoms. Yeah, so things like tiredness and fatigue, things like recurrent infections, in the private parts, and urinary tract infections, worsening vision, things like numbness and burning of the feet. These are basically symptoms that may not be, they can be attributable to many other conditions. For example, being tired and being fatigued may be attributed to other things. In fact, many times when someone comes complaining of that, we start asking them, okay, have you been overworking? Are you stressed, and so forth? So these are symptoms that can be attributed to other things, but they could also be attributed to diabetes. Now, I think we all know the classic presentation of someone with diabetes is usually basically increased thirst, peeing a lot. So they tell you that they are waking up 5, 6 times a night to pee. They are very thirsty. maybe they're eating a lot. Despite eating a lot, they are gaining, I mean, they are losing weight, or they have blurred vision. So these are some of the other symptoms that these are what we call classic symptoms. Unfortunately, not many people with diabetes will present with classic symptoms, and by the time they are presenting with classic symptoms, already the sugar has been in the body for several years. Yeah, so that is why it is very, very important to do early screening, especially if you have the risk factors. Now, why is it that we treat diabetes? We treat diabetes because of the complications that it can bring in the future. Okay. Now, uh, diabetes is very unforgiving. You know? If it is not well controlled, it is going to affect some of the major organs. It's going to affect the heart. It's going to affect the brain. It may affect the kidney, um, and it may cause all sorts of complications, kidney problems, heart failure, strokes, and so forth and so on, dementia, and many of these other complications that can result from poorly controlled diabetes. It can also uh, cause other complications in other organs. For example, the nerves. It can cause problems with the nerves, where patients present with numbness and burning sensation, and pain in the feet, and they tell you that at night they feel the feet will feel very hot, and they have to sort of uncover their feet for there to be some bit of cold, or they tell you that they're having numbness and those kind of things. Those are some of the complications of that. The eyes, it can worsen vision, it can cause cataracts and so forth and so on. It will cause reduced immunity, and I think we saw this very well during the COVID era, when people with poorly controlled diabetes had a higher likelihood of poor outcomes when they contracted COVID. The wounds, they don't heal as well. So especially wounds in the feet. And I think all of us, we have experienced this. We have seen probably patients who present with wounds in the feet, and they tell you that this wound has been there for many months and it's not healing. Some people even require amputations. All this is because of poorly controlled diabetes. The other very important bit is sexual function. It will affect sexual function for men who they have diabetes. They may get things like erectile dysfunction and so forth and so on. And for women, they may get female sexual dysfunction and so forth and so on. Now, this is the reason why we treat diabetes. We treat diabetes because it will definitely, if it is left, if it's poorly controlled, it is going to give these kind of complications. Now, what are some of the what is the treatments? What are the treatments that we administer in someone with diabetes? The most important one is lifestyle modification. So that's very key. We are going to come back to this towards the end. So diet, exercise, weight loss, uh, managing stress levels. We are going to talk about this at the end. I'm going to emphasize on it a bit more. And then there's the issue of medications. We have many types of medications for diabetes, and this is decided by the doctor. um, hypertension Hypertension or high blood pressure is when you have elevated blood pressure of more than 140 over 90. So if you have a high pressure of more than 140 over 90 on more than two occasions, then this might actually mean that your pressure is chronically elevated. And if it's chronically elevated, then it will cause complications. So the higher the reading, the more dangerous it is. So your patient has a reading of 180, 200, 250, 230, and so forth. That's a much, it's worse than someone who has a reading of 150, and someone with 150 is worse than someone with a reading of 140, and so forth and so on. So the higher the reading, the more dangerous it is. And basically, what blood pressure is pressure within your arteries. Okay, so you could think about it. If the arteries are a pipe and the blood is the water flowing through that pipe, if the water flows if the blood flows through the arteries in high pressure, eventually it will start causing damage to that artery. Yeah. And if that artery is in the heart, then it will cause damage to the heart. If that artery is in the brain, it will cause damage to the brain, and so forth, and so on. Now, what are some of the risk factors of high blood pressure? Again, they look the same as the ones for diabetes. These are obesity and overweight, people with sedentary lifestyles, a family history. If you have diabetes, that could also be, or high cholesterol, that could also be another cause or risk factor for diabetes. I mean, for developing high blood pressure. History of sudden deaths, heart attacks, strokes in the family, that could also be a, a risk factor for developing high blood pressure. And then certain types of medications, can also predispose one to getting high blood pressure, like things like, if you're using painkillers of a certain class, like in a brufen, diclofenac, if you're using those for a long time, that could actually predispose one to getting a high blood pressure. Now, the reason why, I mean, some of the symptoms of high blood pressure include, the symptoms. In fact, many times high blood pressure is does not present with any symptom. Yeah. And I think, maybe for those of us in the audience, if I was to ask you how was the blood pressure diagnosed, I'm sure some of you would tell me that you had just gone to hospital for something else. Maybe you had a toothache, or maybe you had gone to do a medical test, or just something totally unrelated, and then when you had your pressure done, it was found to be high. Okay. So in fact, that is how most people we diagnose blood pressure, as. Yeah. But there are there may be some subtle symptoms. Yeah. There may be some symptoms that are, you know they are neither here nor there, that can be also attributed to other things. Yeah. So things like, they may get some bit of headaches, they may get some pulsations, whether that's in the ears or in the arteries in the neck. You may sort of, get some bit of pulsations there, some bit of tiredness, but the symptoms are not, that they don't correlate very well with the, with the level of the blood pressure. Yeah. They don't correlate very well. And so that's why when you come to hospital, everyone who comes to hospital has to get a blood pressure done, whether you're coming for a medical check, whether you're coming because your tooth is hurting, or your toe is hurting, you have to get a blood pressure check, because that's a, it's an area where we can easily catch and screen for blood pressure. Now, why is it that we treat blood pressure even though it does not give you any symptoms? We treat it again because of the complications that pressure can give. I always say this to my patients, that blood pressure is not really a disease. Yeah. If you think about it, a disease is something, or is a condition that gives you symptoms. It makes you feel a certain way. But blood pressure does not make you feel anything. Yeah. In fact, I tell them that it's more of a risk factor to some major complications that can come. It can give you a stroke. Yeah. It can give you heart attacks or heart failure. It can give you kidney damage, eye damage, and the list is endless. Yeah. The list is endless. Now, so that's why we treat high blood pressure. Yeah. And pressure can also be very unforgiving. Yeah. If you have had pressure for many years, then eventually one can easily get a stroke. And this is what happens. uh, some of these conditions begin when one is in the middle age. Yeah. So maybe they're in their 30s, in their 40s, maybe in their 50s there. And during this time, you don't have many symptoms. Yeah. So you're basically having this condition, but because it doesn't give you any problems, it doesn't give you any symptoms, then you're sort of, many people tend to trivialize that condition, or that risk factor. Yeah. And then these things, they catch up with one now in the retirement age. They catch up with one in their 60s, in their 70s, and so forth and so on. And of course, because of all the life changes that are happening, and because of the effect of age and whatnot, when those complications get you at that point, yeah, then also it becomes quite a thing. So it's important that we take these issues seriously. If there's if there's a blood pressure issue, if there's a diabetes issue, then it's important just to act accordingly. Treatment, lifestyle modification is very important. I'm going to touch a bit on this later. And then the issue of medication. The other thing is cholesterol. So basically, we call it dyslipidemia in medical terms, but basically that's when you have elevated cholesterol. So when you have elevated cholesterol in the blood, again, it can cause other problems. There are two types of cholesterol. We have the good cholesterol, we have the bad cholesterol. The bad cholesterol, there are two types. There's a type that blocks arteries, yeah, and I think I have a picture here, so you can see in this photo here, if this is a blood vessel, and you can see the cholesterol building up within the artery, and then if it gets blocked at this point.
Sorry about that. We seem to have lost Daktari, but we are hoping that he'll come back online soon.
Okay, good evening, everyone. Sorry about Daktari. He's trying to log in. Just let's give him a few minutes. Yeah. My name is Diana from Kenyan Alliance. We are the ones who offer the medical services for your scheme. I work there as a care manager. So basically, we manage the medical bit of the scheme. So in case of any inquiries, I know we've communicated with a few of the congregants here, especially I know quite a number. We've had a conversation here and there when they're in hospital, when they need to go to hospital, and we are really grateful for the work for giving us this opportunity. I think this is the 5th year. It's the 5th year, eh? Yeah, I joined Kenyan Alliance 5 years ago. So I remember the first time I came there, I came with Dr. Sheila. I think there was the first year, there was something happening in the church and she tagged me along. So it's quite a privilege to serve the community there. Yeah, and I would like to apologize for Dr. Sheila. She's been in a meeting, a strategy meeting. So she will join us later, hopefully before the meeting ends. So yeah, I think I don't have a lot to say. We have quite a number of our team members also in the call. We have Elizabeth, who is also a care manager. We also have Silas, and we also have Tracy and Joseph also. We are quite a number, and we are also, we all support the team. We all support the scheme, and we are grateful for even giving us this opportunity.
Okay, so I was just talking about the cholesterol. I was talking about the kind of bad cholesterol that causes one, it gives us information about insulin not working properly. It's called triglycerides. So whenever we see this kind of insulin, then whenever I see this kind of insulin, then this kind of cholesterol, then we know that the insulin is not working properly, and so it can actually predict getting diabetes by a number of years. So if you ever go to and have a cholesterol check, and then you discover that the triglycerides are elevated and then the good cholesterol is low, and even if your sugar is normal, we call that metabolic syndrome, and that can actually predate diabetes by a number of years. Now, cholesterol is totally asymptomatic. Rather, it will not give you any symptoms. And whenever you get the symptoms, it will be the symptoms of a complication. So I talked about a heart attack. If that happens in the heart, that's blockage of the arteries supplying supplying the heart. A brain attack, that's what we call a stroke. Or a leg attack, yeah, that's what we call peripheral artery disease. And the treatment is lifestyle and medication. Now, as I conclude, I just want to, make these three points. Yeah. Number one, that it's important for us to go for regular checkups for screening purposes. As you can see, a lot of these conditions are asymptomatic. They will not have any symptoms. Yeah. Um, Many times you will not get any symptom, you'll just be okay. So it's important, if you have the risk factors that I talked about, if you have any of those, then it's important that you go for regular medical checkups. Okay. So go have your sugar checked, have your cholesterol checked, so that you can prevent yourself from getting any of these complications in the future. Now, when we talk about checkups, we do check for these three conditions that I've talked about, but also there's screening for cancer. And some of the common cancers that we screen for include, for the women, we have the cervical cancer, we do a pap smear. We have the breast cancer, we do a mammogram. And we have so that's for the ladies. Yeah. So mammogram and and cervical cancer using the pap smear. So this is for the mammogram for anyone above the age of 40, the cervical cancer screening or the pap smear for anyone who's sexually active above the age of 25. So it's important that we go get screened. Now, these are screening modalities that have actually saved lives. Why? Because they're able to pick the cancer early, and when they pick the cancer early, you can pick up normal cells before they become cancer, and they can be treated. And this has actually saved many lives. And in medical terms, we call that a mortality benefit. They reduce the rates of death and illness and major illness from these cancers. For the men, we have prostate cancer screening. Now, prostate cancer screening has its own controversies, but for the most part, we do recommend prostate cancer, particularly if you have had a family history of prostate cancer. So it's important that we have that screened. Now, there's also colon cancer screening for both male and female. We use three modalities. We use a colonoscopy once every 10 years. We use a stool test also, just to screen for that. So the point I'm making there is that it is very important that we go for screening, for both these metabolic diseases that I've talked about, but also for cancer. Now, when we talk about lifestyle, let me just go back to the issue of lifestyle. We are talking about three major things, and the three major things are diet, exercise, and weight loss. Okay, and then other things like managing stress, making sure you sleep, at least 7 to 9 hours every day, and so forth and so on. Now, when it comes to diet, I like to simplify it because there are so many diets, and sometimes it's easy to get very confused. Yeah. Because this one will come with this recommendation, then this other one with this other recommendation. So it's very easy to get confused, and I think that's an area where in the medical fraternity we need to do better. Now, when it comes to diet, this is what I say to my patients, that look, first of all, do everything in moderation. Don't do things excessively. Yeah. Don't eat too much as though you're not going to eat again in your life. So just eat in moderation. Yeah. I remember there's once we went for a Rorashio function somewhere, yeah, in Nyeri. And when we were being served food, I was just looking at, I think sometimes I'm biased because I'm a doctor, so I sort of tend to be judgmental, but that's not a good thing. But I sort of was looking at the kind of food that people were serving themselves, and I'm telling you, people were just putting a lot of food on the plates, and then they put melon on top, and then there's no space to put the soda, so they have to hold it in the armpit, and then they have to hold the banana in the other armpit. So it was just too much food, yeah. And I know here, I'm sure we are, I'm sure there's no one who does that. So the principle there is everything in moderation. Secondly, there are foods that that we want ourselves to avoid. So anything that has a lot of refined sugar, yeah, and there's a lot of sugar in our diets, yeah. If you think about it, a lot of sugar in our meals, yeah. Um, from the refined sugar, the one that we put in our tea or coffee, to the soft drinks like soda, and the juices that we buy, the Del Montes and the Picanas and those things, to the pastries that we sometimes buy, the queen cakes and the whatnot, and the sweets. Yeah, in fact, the other day my wife was just telling me about how they make sweets. Yeah, and it's basically they just have this sugary thing that they boil, and then they put a bit of mint, and then they call that tropical, and they put something else, and then they call that a lollipop, and basically it's sugar. Yeah, so we want to avoid any refined sugar, yeah, or to keep it to a bare minimum, yeah. I mean, if it's a birthday and it's your grandchild who's giving you a cake, then you can have that one small piece, but it shouldn't be something that we do all the time. Then the other thing is, we if it's the food groups, yeah, we want to have a lot of vegetables. First of all, it should be a balanced diet. Then vegetables should occupy 50% of the plate, and then the other half, you can have a bit of proteins there, and then a bit of carbohydrates there. Now, the kind of carbohydrates we prefer are the kind of carbohydrates that have a fiber in them, yeah. So that's a whole meal, or the brown, the ones that we see. Not that you cannot eat the others, yeah. I mean, if that's what's available, then you can go ahead and have that, but then also even in a small portion. Now, you can eat fruits, but also that is in moderation. There are people who eat fruits as though it's a meal, and then they have a whole plate of fruits. They have this fruit and this other one, and actually it's enough to make them full. I don't think that's very healthy, because some of these fruits also, they're engineered to increase their sugar content, and I think that also is not is not very good. So I don't know whether you can hear me. I'm still audible.
Yeah.
Yes,
Yes, you
Daktari.
are.
Okay, very good. So yeah, so that's about diet. So we are saying, avoid refined sugar, avoid a lot of salt, because salt also has been shown to increase the to increase the blood pressure. And then also avoid a lot of fatty foods, yeah, or things that 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 have a lot of fat in them, particularly the solid fat, what we call in medical terms saturated fats or trans fats, yeah. So because they increase the level of cholesterol. So everything in moderation, I think that is what I would summarize it as. There are those things that we want us to avoid. Everything else we can go ahead and eat, but we do that in moderation, and then try to see whether we can include more vegetables, reduce carbs, and some bit of proteins there, whether it's animal protein or plant protein. Exercise, extremely important. The recommendation is at least 30 minutes of exercise 5 days a week. That's a recommendation. Any form of exercise is better than none. Okay, so whether it's walking, or or just being active, that's better than sitting. But someone who goes to the gym is better than the one who just strolls, or just walks. So the more the exercise, the better. Yeah, obviously we do it we start slow, so we don't go full out. We sort of start slow and then sort of build up. So but it's important that we move. Now, we could do that formally by doing formal exercises, where we are doing gym, we are going for jogging in the morning or in the evening, or we have a treadmill in the house and so forth. But I know that many of us, those of us who are working, maybe sometimes there's no much time. So you can include some of those activities in your day-to-day activities. You could have, for example, a day when you go using public transport. Maybe the day you're not very busy. Yeah, so you can actually go with using public transport, and that can encourage you to walk more. In your places where you work, you can choose not to use the lifts, and you can walk up the stairs. For example, during the lunch hour, instead of going to the staff room, you can actually just go and do 2 laps around your office block, for example, and those kind of things that you can incorporate to your in your day-to-day life can actually count as far as physical activity is concerned. Weight loss is very important, yeah, and I want to say here that the thing that determines our weight is mostly the food we eat, not exercise. So if you do all the exercise in this world but do not eat accordingly, then your weight might not go away. Yeah, so it's important that as much as we are exercising, that we also do eat right, and do everything in moderation. Stress levels. I know many of us we're in highly stressful work environments, maybe business, this kind of economy and so forth. But it's important to manage that. Sleep is very important. Yeah, it's now increasingly recognized that proper sleep actually does contribute to good sugar control as well as good blood pressure control. And the recommendation is 7 to 9 hours of good quality sleep. Okay, and I know many of us sleep less. We sleep for 5 hours, 4 hours, and so forth. So it's important just to plan ourselves so that we are sleeping well. And then now those people who maybe they drink a lot of alcohol, we ask them not to abstain from that, or to reduce. Those people who smoke, we ask them to quit. Those people who use other substances, recreational drugs, and so forth, we ask them to quit, and that kind of thing. So I want to end there. And I want to maybe open it up for any questions. But in summary, I just want to say 3 things. First, it's important to get screened, get checked, because many of these conditions do not have any symptoms. And then number 2, it's important, that our lifestyle, the lifestyle is a main medication, or is a main therapy, if I could put it that way. Lifestyle modification is the main therapy, so it's important that our lifestyles, are healthy. And then number 3, if any of these conditions are there already, then it's important to adhere to the prescribed medication and to the prescribed clinic visits. So I want to end there, and I know it's 8:55. I don't know how much time we have for Q&A, but I want to return the meeting to the chairman. Maybe you can coordinate the question part, and then we can conclude. Thank you.
Thank you, Daktari. We have 2 raised hands so far, Abraham and Kezia. I think we shall follow in that order. Kindly ask your questions. And then I think, Daktari, you can... So, okay, there's another third one, Joseph Guge. But let us start with the first 2, and then we see how long they'll take. Thank you.
Okay.
Okay, let us move to Joseph Guge.
Yeah, thank Daktari for your good presentation. My question is about diabetic, where you find somebody has raw sugar. This person is, I don't know how he's supposed to be advised with the raw sugar. You have talked about the high elevated, but what about when it is raw? What about when the blood pressure is raw? What about when the cholesterol is very low? Maybe you can comment on that, because there are some people who are diabetic, but they are advised in the morning they have to take a cup of a spoon of sugar. Thank you.
Okay. Thank you, Joseph, for asking that question. Okay, so yes, we do have situations where we have low sugar in patients who have diabetes. So, and in fact, I want to say that hypoglycemia, we call it hypoglycemia in medical terms. So low blood sugar is actually more dangerous than high blood sugar, because it can start giving you what we call neurological symptoms. So these are symptoms basically where someone loses consciousness and the brain doesn't function properly because of the low sugar. So low sugar is extremely dangerous, and we have to address it. Now, there are many. What we do when we're evaluating someone with low sugar is we want to look for the reason for that. And when you take the patient's history, you may be able to identify the cause. So it may be the certain medications that can cause low sugar. So for example, there are certain oral tablets. Like I don't know, some of you may be familiar with a tablet called Nogluc in diabetes that can actually cause low sugar. Insulin, people who are taking insulin and then they take insulin and do not eat, or they inject excessive amount of insulin, that can also predispose one to low sugar. I think on Saturday I saw a lady who she was supposed to be taking 14 units of insulin, but when I gave her the injection needle and asked her to pull the 14 units, she actually pulled 40 units, and she was actually getting these rather low blood sugar episodes, a lot. Yeah. So um yeah, so we basically look for the reason. Yeah, so whether it's diet or medication and so forth and so on. Now, cholesterol, we don't have a minimum. We actually don't have a minimum that we can go to. So high cholesterol is what is dangerous. Low cholesterol is good. It's not dangerous. Yeah. And then low blood pressure also is an issue. So whenever someone presents with low blood pressure, we want to know what the reason is. If they have, it may be that they have a lot of blood pressure medication, and if that's the case, then we reduce the number of medications that the patient has. Yeah, sometimes they may have changed their lifestyle so much that they do not need the medications anymore. So in that case, also we remove the medications. I've seen a question about from Nimrod Kehio. Can natural honey cause diabetes? Yeah. So natural honey is good, but it's still sugar. Yeah, it is still sugar. So that is important for us to understand, that honey is still sugar. It will still have the same effect as any of the other sugars. So it's important that even if we choose to take it, then we have to do that in moderation. Yeah. So there are some people who will totally replace refined sugar, mumias, with honey, but doing so might not really change much. But if you choose to take it, we need to do that in moderation. So I don't know whether there are any other questions.
Yes, I see a raised hand from Peter.
Goge. Hello?
Oh, go
Yes,
ahead,
please.
Ruge.
Yeah, we have so many people behind the bars because you have served with somebody who is diabetic. He get a coma, he die at night, and they assume now you are the cause of the death, but because either of the high sugar or the low sugar. Maybe we should educate our people. I served with somebody who had blood sugar which was high, and he told me he was supposed to inform me at night he has a high blood sugar or he has a hypertension. So if anything, what I'm supposed to do. I don't know how you advise your patients and friends.
Yeah. So yeah. So it's true that especially for patients who are taking insulin, their sugars, if they are not very well controlled, they may tend to fluctuate, yeah, up or down, especially at night. So that's true. I think the most important thing is to advise them to do a lot of sugar monitoring. So it's important that anyone who has diabetes has their own glucometer for them to monitor their sugars. And anytime they don't feel okay, yeah, maybe they wake up in the middle of the night, they are not feeling okay, then they need to check their sugars. They need to be educated about the symptoms of low blood sugar. Symptoms of low blood sugar are the same symptoms you would get when you're really scared. Yeah, like when maybe a big dog is chasing you. Yeah. So what are some of the symptoms that you would get? You would get things like sweating, you know, your heart rate would be racing. You know, you'd be tremor, you'd have tremors and so forth. So the same thing, that the same symptoms you get when you're really scared also would present the same way when you're having a low blood sugar. So when you educate people about these things, then they are knowledgeable and then they're able to act accordingly. So thank you, Joseph, for that observation.
Also, on top of that, it's
Yeah,
also always not to stigmatize the conditions.
sure,
It is always good to, when you have a sleepover, you tell your friend or your host you have this condition,
sure.
so that especially men, when they have sleepover, wherever they go, they have these issues, and we have seen them, most of them dying, and some people, some ladies spending the whole of their life in prisons. I think it's advisable.
Thank you, Joseph. Any more questions? Okay, I think we are through with that.
Sorry,
Q&A.
sorry. I had raised my hand up. Sorry.
Okay, please ask Tabitha.
Mine is not, yeah, not mine is not really a question, but I kind of missed on the reason why you call them metabolic diseases. Could you please repeat why they're called metabolic diseases?
Oh yeah.
Kindly.
Okay,
Thank you.
thank you, Thanks, Tabitha. So, uh, to put it simply, when we talk about metabolism or metabolic, we mean um, basically I mean how the body handles the food that we eat. Yeah. So that's basically what metabolic means. Yeah. So and diabetes, high blood pressure, and cholesterol has a lot to do with how the body handles what we put inside it. Yeah. So, for example, in diabetes, it's a problem with how the body handles sugar. So the body is not able basically to handle sugar, and the sugar now goes up in the blood, and so you get, diabetes as a metabolic disease. The same thing with high cholesterol. The same thing with blood pressure. Now, so many people also ask, just to digress a bit, what causes these conditions? Yeah, what causes diabetes? What causes high blood pressure? What causes cholesterol? Now, when we talk about cause, in medical terms, these metabolic diseases, we don't talk about a cause, we talk about association. Yeah, and there's basically a small difference there. Something that causes something is you can directly attribute one factor as causing another factor. For example, if you have a boil on the leg, it is because of an infection. So we know that the infection has caused that boil. However, when you have diabetes, it is not because of one thing. Yeah, in fact, it's a multiplicity of things. It could be because of the diet. It could be there's a small contribution from genetics. There's a small contribution from all these other things. So we don't call those things causes. We call them associations. Yeah. So we may not be able to answer why have you had high blood pressure. It could be maybe there's some genetic contribution, maybe there's this, there's that, and so forth and so on. So basically, metabolic is really because it has to do with how the body handles food. Now, yeah. So I hope that's clear, Tabitha. So I want to thank you once again, because I assume there are no other questions. Um, so thank you for listening, and I hope that we have all gotten something from this talk. You can find us at Emory Hospital. We have a clinic that runs every Saturday morning between 8 and 10. And there's also another colleague of mine, a physician also, who comes on Tuesdays between 3 p.m. and 6 p.m. So anytime you can just pass by and we'll be able to take care of you. Otherwise, thank you, Roy, and thank you, the team from the insurance companies, for this invite. Over to you.
Thank you very much, Daktari, for that very interesting presentation. And I hope that all of us have grasped something, and we need to be on our toes in understanding these conditions as we age. And I think for now, I just want to ask Regina, who was not able to say hello to us, just to say something before I now ask our evangelist to wind up the presentation. Regina, karibu.
Members, mine is just to say thank you to Daktari for the presentation. I believe we have all picked which is ours, and we endeavor to practice to avoid getting this lifestyle. And those of us who may have them, it's good to have them well managed. On behalf of the Kenyan Alliance, we say thank you for this opportunity, and we look forward to continued relationship with the members. Thank you.
Thank you, Regina. Evangelist Harrison, I think we are done. I think you can now take over from there. Thank you very much.
Thank you so much, Roy, and the panelists we had tonight. We want to appreciate you all for the great work you are doing, and even our relationship and our partnership. We are looking forward for more, and we pray that God is going to continue even guiding you in your endeavors. So we have come to the end of our virtual engagement, and I want to appreciate everyone who turned up tonight. And as always, we have this session recorded, and you can always revisit it at our YouTube channel, and even the previous ones that we have done. You can always just go and listen to it time and time again. And in case you also have areas that you feel as a church we should respond to, have a conversation about, please reach to us so that we can also arrange for such virtual engagements. May God bless you and you well. So we have come to the end of our session, and therefore I want us to end by words of grace together. And now, yes, Regina.
There is Dr. Sheila who has joined us. Can she say something?
All right. Yeah, sure.
Dr. Sheila, from
Okay.
Kenyan Alliance. Daktari, karibu.
Oh, thank you, Regina. I was hoping to be a silent follower today. I joined in quite early. Dr. Mucheru, thank you for your talk through it. I think sometimes it's good when we are listeners. We enjoy listening and not being the doctors sometimes. So thank you for that. I think everybody has been able to pick something, as has been said. To PCA Church, we thank you for the partnership we have with you. And we look forward to having many more sessions like this. Regina, thank you as well for the coordination. And I wish you all a good evening, a blessed evening. God bless.
Thank you, Daktari.
All right. So thank you so much, the panelists once again. So God bless us. We want now come to the end and share the words of grace. And now may the grace of our Lord Jesus Christ and the love of God and the Holy Spirit and forevermore.
Amen.
Amen. So thank you so much.
Amen.
May God bless you all. Let us stay tuned every other Tuesday for the engagement, and we continue learning. So God bless you and have a good night. Thank you.